Welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Wiening. On today's episode, it's actually like a talkback episode. Thank you for all the comments on our videos as well as the emails to our website. We're just going to try to deal with some of the questions that the viewers have posted. Paul, where do you want to start?
Yeah, thank you very much. We have been getting a lot of emails and a lot of comments, and we can't answer them all, but we just picked a few that we would try and address. So I got one here. So it's hard to read my own handwriting. That's typical. Fifth metatarsal fracture. Oh yeah, someone was asking about their fifth metatarsal fracture. When can they weight bear? Personally, I treat fifth metatarsal fractures in a walking boot, a cast boot, a short one, and I let them weight bear as tolerated right away.
Me too. And then how long are they typically in that boot?
About 6 weeks.
Yeah, one orthopedic unit. And if it doesn't heal at 6 weeks, what do you do?
I got another email about that, actually.
Okay.
Someone had fifth metatarsal that after 6 weeks or 8 weeks, it hasn't started healing yet on x-ray. You can still see the fracture. So what do I do with that? If you're not having any pain, I don't care what the x-ray looks like. If you're walking and you're back to your normal life and the x-ray shows that the fracture's still there, I'm not too worried about it because it could be a fibrous union that just doesn't show up on x-ray, so tough fibrous tissue holding the bone together, and that's fine.
Yep.
If it is symptomatic and you go on to have a non-union or a delayed union, which is the term we use when the bone doesn't heal after the expected period of time for that bone, then you might need an intervention like a bone stimulator or even surgery.
Yeah, usually I'll say if after 6 weeks it didn't work, I'd say let's try another 6 weeks.
Yeah.
I don't want to rush into an operation, but yeah, people start to get frustrated, particularly if they can't drive because of that or if it's impacting their exercise. But yeah, I think that's reasonable. Bone stimulator, make sure they're actually wearing the boot. If you told them to wear a boot, that's another thing, and then possibly an operation.
Yeah, very rare though. Honestly, I'm just trying to think now while you were talking.
Yeah.
While you were talking, I was thinking.
Yeah.
I can't remember the last time we've had to operate on one of these fifth metatarsal fractures that didn't heal.
Yeah, it's pretty uncommon. Sometimes the really displaced ones do take a long time, and they look ugly on x-ray for a long time, and the patients keep coming in and saying, actually looks exactly the same. I'm like, don't worry, it's going to be okay.
All right, next.
So I had someone who had left a comment about a limp after a total hip replacement. So what I tell people about limps for total hip replacement is, thankfully they're pretty uncommon. I tell people about 10% of people could potentially have a permanent limp, and there are a large number of factors. So the number one factor for me that makes me nervous about a persistent limp is when I do the operation, when we dissect through the muscles called your abductors, if they already don't look very good. That makes me nervous. At the time of surgery, you can repair them somewhat, you can sew them back together, but if they're poor quality, that is potential for a persistent limp. The other couple things that I would say is if you have a bad fall early on, often you can disrupt the repair at the time of surgery. Or people that don't do their physiotherapy properly. What about you, Paul?
Just like that.
I say work it out. So people say, well, what should I do? I'm 3 months. I still have an ugly limp. If they have no pain, I say, well, that's just sometimes the way that it goes. But definitely try the exercises and see what happens. But there's typically not an intervention that's going to make your limp go away. Some people say, well, can you go in and try to repair the muscle? I think there probably are people that would consider doing that. That is not something that I would do because I think it can make you worse.
Agree.
Okay.
I had a question here. Oh yeah, this one email was asking about a total hip replacement. Had one total hip replacement, how long to wait before the next one? I usually say 3 months. That gives you enough time to rehab as much as possible from the first hip before you have the second hip done. And of course that's variable. If you had a tough time with the first hip replacement, it might be a bit longer, but usually we say at least 3 months.
I also tell people, wait and see how the first one goes, because you might have had such a tough time you want to wait it out, or because now you have one good hip, maybe the other hip's going to feel better. So
good point.
I think just because you've committed even to the second one, because a lot of my patients want to book the second one before they even have the first one, and then they feel like obligated. And I'm like, well, you should wait as long as you can. And if you feel like hey, I'm too good, I don't want to get the operation, I think you set yourself up for failure if you're not needing it. So wait if you can.
This email also suggested that we were cuties. Might I suggest you adjust the resolution on your computer, tablet, phone, something's wrong there, or perhaps get your cataracts checked. It's not That's not the definition of cutie.
I had a comment about microfracturing in the setting of arthroscopy, and the gist of the comment was, well, if I have a torn meniscus and there's some arthritis there, can't you just microfracture? So microfracturing is when there's an area of bare bone where all the cartilage is gone, and we use a sharp awl or some type of device to penetrate the bone in an effort to get some back bleeding, and then your body can form almost like a scar type cartilage over top of that area. I think this is not an unreasonable option in the right setting. So you don't want to have a massive area of severe arthritis, and also there are particular locations within your knee that respond better to microfracture than not, but it is potentially an option, and your surgeon probably should discuss that with you before surgery, because it may impact your recovery, it may be delayed, and they may even alter the amount that you weight for after surgery. Paul, do you tell me anything different from microfracture?
No, that's it. Yeah.
Yeah, you're kind of, I mean, you're nearing the end, but it's something that's worth considering for sure.
Having said that, there is hope on newer and possibly more effective treatments coming down the pipe. A lot of biologic research is going on where we can repair the cartilage damage with some biologic stimulators. But that's maybe another video. We can discuss some of those.
Absolutely.
I've got a question from a young woman in the Philippines who's 28, turning 29, and has is developing hip pain. So hip pain in the young person. Get that checked out. It could be a number of things. Some of the more common things are things like labral tears.
Yep.
Or it could be a soft tissue sort of muscular strain or sprain, or something more difficult to treat, like a dysplastic hips, where you have a congenital dysplasia of the hip or developmental dysplasia of the hip, where your hips weren't in their sockets as a child. It could go undetected, and then certainly in your 20s or 30s you could develop a lot of hip arthritis and pain. And of course, whenever you have any hip pain, you should get it checked out by your doctor. There's also, some more serious and potentially life-threatening causes of hip pain. Metastatic disease, tumors, that kind of stuff. Very rare, but can easily be ruled out with an x-ray.
Yeah, see your doctor, get an x-ray, and then you'll be sent on appropriately.
All
Okay,
right.
well, hey, thanks for all the comments and the emails. If you have any further questions, please feel free to email us at info@talkingwithdocs.com, or continue to leave comments on the videos themselves.
And remember, you are in charge of your own health.
See you next time.